When the doctor came back in and said I'd had a bad brain bleed, it was kind of a slap in the face. I didn't expect that.
Each year, 125,000 Americans, like Joel, suffer a bleed around the brain called a subdural hematoma. Some people can get this brain bleed even after a small injury, like bumping your head against the door. Many people don't realize they're bleeding until the blood builds up, it presses on the brain, and causes them to become weak, experience seizures, or even die. We doctors treat these brain bleeds by draining blood out through small holes we drill in the skull while the patient is still awake, or by removing a section of the skull altogether.
I remember hearing them drilling the hole. Ever heard a jackhammer busting up concrete? That's the way it sounded to me.
As old blood breaks down after surgery, it can irritate the brain, creating almost a rash that causes even more bleeding.
We have something called the gut-brain axis, and your brain and your gut are directly and intimately linked.
The trillions of bacteria that live inside our guts, called the microbiome, might be the solution so that care teams don't have to drill into the heads of patients like Joel anymore. We're testing whether treating the bacteria in the gut can help lower inflammation and even prevent future brain bleeds. First, we'll work with 20 patients with repeat brain bleeds. They'll donate brain fluid drained out from the skull, blood, and stool samples. Then we'll see if we can find any link between the bacteria in their gut and their risk for more bleeding. If we find any bacteria troublemakers, we'll flag them as harmful. Once we know which ones are causing problems, we'll explore ways to remove the bad bacteria and bring back the healthy bacteria. Our new treatments to improve the microbiome could take the form of a probiotic pill, a stool transplant, or diet changes.
Then we know we're really onto something and we do our microbiome manipulation, and now all of a sudden no one needs surgery anymore.
This could be the first non-surgical treatment that uses the microbiome to prevent these potentially deadly brain bleeds. And we'll use our findings to explore ways to treat the millions of Americans with other common brain disorders such as traumatic brain injury, strokes, and dementia.